everyone. Welcome to our next episode in our Suicide Postvention podcast series. My name is Sarra Nazem, and I'm a clinical research psychologist at the Rocky Mountain MIRAC. We're very excited for today's podcast, which will focus on the role of suicide postvention in workplace settings, such as crisis centers. We're joined by Greg Hughes and Joi Sabrina, employees of the Veterans Crisis Line, who will be telling us a bit more about their work and why suicide postvention is important to the work that they do. Thank you so much for joining us today. And I'm going to first turn it over to the two of you to provide brief introductions of yourselves. Greg, let's start with you.
Thanks, Sarah. So I'm Greg Hughes. I'm currently the Director of Field Operations for the Veterans Crisis Line. So in that role, I primarily function as the liaison between the VCL and the medical centers and staff in the medical centers across the country. Prior to that, I worked in the Office of Suicide Prevention as the Director of Field Operations there, and in that role was the liaison between VACO and SPC staff in the field. And then prior to that was the Director at the Veterans Crisis Line for a period of time, and prior to that for 8 years was the Chief of Social Work at the Durham VA. And while I was at the Durham VA, one of the things I used to do as chief was I filled in quite a bit in the PEC, the Psychiatric Emergency Clinic, just because it was a particular interest of mine. Prior to that, I worked in the state of Massachusetts for a number of years in mental health and substance abuse, but really started my career working in a crisis unit for the Department of Mental Health, and also in a local hospital in their ER doing crisis treatment. So I have a fair amount of crisis experience.
Great. Thanks so much for joining us. We'll likely tap into a lot of that expertise, especially across different settings that you've worked in, to pick your brain a bit. And Joi Sabrina, do you want to give a brief introduction of yourself?
Oh, sure. Awesome. My name is Joi Sabrina. I am a team operations coordinator with the Veterans Crisis Line here in Topeka, Kansas. That basically means that we supervise the supervisors here. We also make sure that we act as liaisons between the executive leadership and the frontline staff, making sure that the frontline supervisors have all the tools that they need to provide guidance and support to our responders and our SSAs, social service assistants. Prior to coming to the VCL, I worked as a military family life counselor at Warner Robins, working with active duty personnel and their families. Prior to that, I worked in the community of South Georgia, completing crisis assessments as a mobile crisis counselor, and I've also worked with the Department of Juvenile Justice, and I've worked with adults and teens who are experiencing crisis. So that's the bulk of my background.
Fantastic. Super expert in this area too, so thank you so much for joining us. I just wanted to start out kind of big picture, just in case we have some listeners that might not know much about crisis lines. And starting off with just having you give us some background on the National Lifeline and the Veterans Crisis Line. Greg, do you want to jump in first?
Sure. Yeah, so the Veterans Crisis Line is actually part of the National Suicide Prevention Lifeline. It's actually the biggest component of the National Suicide Prevention Lifeline. So when you call the 1-800-273-TALK number and you hit +1, you get connected to the Veterans Crisis Line. And actually, we are now co-branded as the Veterans Crisis Line and the Military Crisis Line because we serve both veterans and active duty members across the country. So the VCL began 10 years ago. In 2007, it was part of a rollout of suicide prevention efforts across the VA that included the development of suicide prevention coordinators at every medical center, as well as some other initiatives related to suicide prevention. Started out in Canandaigua. It was a very small endeavor. I think there was about 30 staff initially. And over the years, it has grown to the point now where it is 500, I think we have somewhere around 540 responders in 3 locations, so Canandaigua, Atlanta, and Topeka. and like I said, 520 responders. So those are actually the staff that are on the phones responding to veterans' calls. Over 800 staff. And the VCL works in a way that is somewhat unique for call centers in that VCL has responders who take the calls. They also have what Joy referenced earlier as SSA, social service assistants. Those are the staff that assist the responders when they actually do an emergency dispatch. So they send emergency personnel out to an individual's location, a veteran's location, because they're at imminent risk of suicide. Or they do what we call facility transport plan, which is when the veteran is, again, at fairly imminent risk, but the responder and the veteran and others that may be with the veteran come up with a plan for the veteran to either be transported or self-transport to an emergency room for immediate intervention. So those social service assistants, they help the responders and actually trying to facilitate the whole logistics around that process. So they communicate with police, they communicate with emergency rooms. So in that way, we're very different than a typical National Suicide Prevention Lifeline call center. Many of those are staffed by volunteers. Some are larger than others, but typically they don't have those social service assistants helping with those emergency dispatches or facility transport plans. And they also don't typically have, and this is a big plus, obviously, to the VA system as a whole, they don't have access to an individual caller's medical record, which, we receive calls from veterans that are engaged in care in VA and that aren't engaged in care in VA. But obviously, if they are, then the responders will ask the veteran if they can access their record. And that can provide a lot of, really important information with regard to kind of how to manage the call and what's going on with that veteran. So, it's a little bit of an overview of the VCL. I'm not sure if I left anything out, but just let me know if you have other questions.
No, that's great. And Joi Sabrina, do you have anything that you'd like to add based on your role and your position of things that are important for our listeners to know about the Veterans Crisis Line?
I think one of the most important things, or one of the takeaways that I had when I first came to the VCL is the extensive amount of training that our responders and our social service assistants receive when coming in to work with the VCL. So of course we're a crisis center first, as Greg noted, how we're a part of the National Crisis Line, the National Suicide Prevention Network. But we of course specialize in working with active duty personnel and military personnel. And what is unique to the VCL is the amount of training that goes into learning about military culture, learning about what separates our veterans, our nation's heroes, from the general population when dealing with crisis, when dealing with suicide, and what are some of the risk factors that may be unique to this population. I think that is something that really gives us a standout, along with, as Greg said, having access to those medical records that we can access when we're given permission by the veteran, but just having that, being in touch with what that veteran may be going through, which makes them different from the general population.
I think there's one other element that I did forget to mention, which does really make us unique as well, and that is that we do have the suicide prevention coordinators at all the medical centers. And so they're not part of the VCL, but they're very closely connected to VCL because the other thing that we do on every call with the veteran is, and this is regardless of whether they're receiving care in the VA or not, is we ask them if they'd like a consult to the local suicide prevention coordinator. And I think every day, VCL averages on average 2,000 calls a day. And of those 2,000 calls, 20% typically result in a referral to the local suicide prevention coordinator. So that's, on average 400 consults that are going out every day for callers to VCL to the local suicide prevention coordinator. And then it's, incumbent upon them to follow up with that veteran, typically within 24 hours, and then to close out the consult within 3 days. And usually that's a consult that's going to connect them to, further resources within the VA system of care. So that's really unique. There are no other suicide prevention, crisis lines, call centers that have anything, any kind of continuity of care in the same manner that VA does.
Yeah, I think it's another example of how the VA is really leading the field in terms of just really comprehensive, enhanced crisis services that we have out there, which is just an outstanding feature of what you all are doing and the work you're doing every day. I had one other question, sort of background, before we move into some of the suicide postvention specific questions and prompts. But you all had started to touch on how the responders and SSAs work with other agencies and other groups, such as thinking about police and other folks that assist with rescues. And I was wondering if you could explain that relationship and how you all connect with people across the country, given that you're only in 3 locations, how you work with local first responders to assist with crises or rescues.
Okay. Yeah, jump in whenever. So, of course, our responders are our frontline, our social service assistants are our frontline staff. Our responders are the ones who actually speak with the veterans, family members, the caller who's calling in crisis. Once it's determined that the caller or the person that the caller is calling on behalf of, the veteran or even a civilian, we'll call them the focus. Once it's determined that the focus is in need of assistance, um, our responders will make contact with our social service assistants, whom act as liaisons between the VCL and dispatch to that local area where the veteran or the focus is located. The responder via IM and via email at times makes contact with the SSA to give as much information as they can. Of course, demographics, name, age, birth date, as much as they have in the location, and then our SSAs do the legwork of actually locating that person, making contact, like I said, with local dispatch and relaying that information to local dispatch to be sure that the focus is attended to and is given the services that they need in the most in the safest manner to the focus and of course to the first responders as possible.
Yeah, and just to add to kind of how we develop that relationship, I think VCL is also fairly recently embarked on kind of a process to try to better educate local law enforcement with regard to what it is that we do. So we developed a brochure that talks about the relationship between VCL and describes what VCL does, but also how VCL can work with local law enforcement. So whenever there's a call now, whenever there's a connection that's made, that we send that brochure electronically to the department, ask them to share it with their staff, and to be aware of how VCL can potentially benefit them in their responses. In addition to that, SPCs have also fairly, I would say within the last 2 years, they've been working on a project where they go to training, and the training is provided through the VA Law Enforcement Training Center. So it's actually pairs of staff from medical centers, and it's SPCs and VA police officers. They go to this training, and basically what they do is they learn. It's a train-the-trainer model where they're learning to instruct local law enforcement on how to best engage with a veteran that's in crisis. So there's been numerous pairs of, SPCs and VA police officers that have gone to this training and then gone out into the community and done typically trainings, and a lot of times it's for, they call it CIT, crisis intervention training, for the local law enforcement, in their kind of their local VA's catchment area. So that's another way that, and when they do that, obviously they're talking about VCL and talking about, if they encounter a veteran in crisis, that is one of the options that they can have that veteran contact the VCL. And we have started to try to work a little bit with some local police jurisdictions after the fact. So if there has been some sort of an involvement or interaction, then we feel like things may have been done a different way, then at times we can reach out to them and try to discuss that, to try to improve practice.
Well, thank you both. I think that's really helpful. Just before we get into the content a bit deeper, is to have that background and understanding of kind of what a day in the life may look like for a VCL responder, and then also the SSAs. So helpful to understand how they're linking with local law enforcement and other agencies that potentially assist you all in the work that you're doing. So next, I want to move us into thinking about suicide postvention within the VCL, and just wanted to start off with kind of a broad question and get the discussion going in terms of what suicide postvention looks like at the VCL and how that may or may not line up with the types of calls or outcomes that you all have with the work that you do.
Yeah, so I think that postvention comes into play in a couple of different ways for VCL. And I'll ask Joi to go into a little bit more specifics with regard to the interaction between supervisory staff and responders and SSAs. But to me, VCL on a daily basis receives calls from a variety of different people. But the two primary issues I think that where postvention comes into play is when there's a veteran that's on the line with the responder, and there may be some type of intervention, emergency dispatch, or whatever that occurs, and that doesn't go well, and it may end in a veteran death. So fortunately, that's not a very frequent event, but it has, and it does happen occasionally that there can be a death that occurs with the responder while they're on the phone with the veteran, or at the time that emergency responders arrive, or shortly thereafter, there's notification back to the VCL that a veteran didn't survive an attempt, or some other feedback to the VCL that the veteran has died by suicide. And so when that occurs, then there's actions that take place. Typically, the responders are notified. So if that call comes into a supervisor, they are notified, and the reason for that is that the thought is that it's better to have that information shared by the supervisor with the responder and an SSA than just to have that information kind of received and they hear about it, but it wasn't kind of in a structured, safe environment that they could hopefully process it with the supervisor and or the second level supervisor, who's the team operations coordinator. The other thing that happens probably a little bit more frequently at VCL is that VCL will get calls from third parties, so family members, loved ones, sometimes police, sometimes other entities that are calling in to report the death of a veteran by suicide. So the responders will take that information. There's a standard template that they complete. They go through a process with the family member, really to ensure that that family member or loved one, whoever it is that's calling in, is safe. So they do a risk assessment with that individual, and then they offer services. So they offer, obviously, sympathy, condolences. They offer grief services, typically through TAPS, so the Tragedy Assistance Program that VA has an MOU with. They offer those services. They offer to outreach directly to them if they would like. They also typically offer them information with regard to the National Cemetery Administration. They usually offer them if the veteran was connected to the VA. They'll offer typically the decedent affairs clerk at the local VA, and then there are other local resources that they can offer as well. And in addition, they'll put in a consult to the local suicide prevention coordinator so that they can reach out to the family member, loved one as well, just in follow up and to see if there's any other needs that they might have. So when that happens, that's kind of the postvention piece that the VCL provides for its callers. And then also when a responder is involved in one of those calls, typically there'll be so that form is completed, that the supervisor is notified that form is completed and that call has taken place. So they'll typically check in with that responder to see how they're doing, how the call went, if there was any concerns. from either the perspective of the caller or from the responder themselves. If there was any impact to them, they can offer them time off the line, and just time to process if they need be. And I'll let Joi talk a little bit more about what's done, in the event that there's a death that occurs when the responder is actually working actively with the veteran.
There are times where a responder has either in the immediate past or in the distant past has worked with a veteran or worked with a caller, and we learn that that caller has died by suicide. Like Greg said, we do find it to be better to go on and inform the responder and also the social service assistant, the SSA, of that passing. The supervisor, usually the person's immediate supervisor or the supervisor who was assisting them during that call, will sit down with the responder, sometimes with the responder and the SSA together, to inform them of the death by suicide, and to also process with the responder and with the SSA. Of course, in suicide work, we tell ourselves that this is the death is not by any cause of our own, but for those of us who've experienced it, there are times that there may be some thoughts of, could I have done anything differently? So most of our supervisors are also clinicians who are able to help process with the responders, with the SSAs, about what took place, and to be sure that they're ready to go back onto the phone. It's not a fitness for duty or fitness for work test, but it is a check-in. After informing and processing with the responders and the SSAs, there are also offered supports, of course, through EAP supports by way of coming back and speaking again with the supervisor or with even a team operations coordinator, and we do frequent check-ins, depending on knowing our responders and our SSAs, and depending on how much it seems that they need that support. It is really important to us, one, that we offer support to our frontline staff. This is a difficult work that we do. It is incredibly demanding, even for those who never experience a caller having died by suicide. But it's just a very demanding work. So it is important that our responders and our SSAs have a sense of community, have a sense of um, their supervisors being available to them in their state of need. And if we have persons who are not ready to get back onto the phone, we'll find alternative duties to allow them time to ease back into this important work that we do. Um, I just really want to relay how important the relationship is between the supervisors and the frontline staff and the social service assistants and even the team operations coordinators, and being able to do this work and having a support system that you feel comfortable going to with questions, and to know that a person will have answers, or at least know where to find those answers.
I agree with Joi, and I think that's one of the things the VCL, since it's undergone some pretty significant growth in the last 3 years. It's gone from probably 200 responders up to the over 500 now. And one of the things that they very purposely did was to readjust the supervisor to staff ratio so that it's 10-1 now. So supervisors do have sufficient time to spend with responders if they've had not just a call that related it or was related to a death, but any type of a difficult call. They're able to go over to process the call with the responder, to take the responder potentially off the line for a period of time. Allow that responder some space to process, and VCL is also very good about, I think that this is where VCL probably is a little bit different than what occurs at most of the medical centers, with regard to postvention, is VCL has the ability to, that we don't have to put people back on the line, on the phones, if we don't feel like they're ready. We don't want to do that because we realize that, we're going to jeopardize that employee as well as potentially jeopardize, any potential veteran caller or third-party caller. So As Joy mentioned, there's a process. If somebody comes offline, has a particularly difficult call, if they're going to stay off the line for, a day or two, or go to, an alternative work duty, they can gradually work that person back onto the lines and really provide a lot more supervision for them and precepting for them as they get back onto, taking active calls. So that's kind of a nice situation that the VCL is, and a nice, means of support that the VCL is able to provide their employees, which is probably a little bit different than, obviously what you would find at a medical center.
Yeah, I think one thing that I wanted to ask you both a bit more about was this idea of a sense of community, which I think you both beautifully described there in several different ways. And want to take it back to what you all had mentioned a little bit ago in terms of lots of training up front when people are brought on as employees of the VCL, whether that be staff, first responders, SSAs. I'm curious how you all are talking about suicide postvention and those pieces potentially during training. So before it even occurs for a responder, another employee, how are you all talking about suicide loss in your training?
During the training, the process that we both described is described in detail during our new employee orientation training, our NEO training, so that responders and SSAs alike know what to expect should the unfortunate occur. During the training process, we're told about. Because I also, went through our NEO process. We are our new employees are told about what the process would be if there should be a completion or a death by suicide, who it is that they're able to speak with, who should they reach out to, and what to expect. So of knowing, I think that I don't want to say it provides comfort, but it can at least provide direction should it occur. We have had situations where maybe the responder wasn't sure if there was a completion while they were on the line, but they knew what steps to take and who to inform, and then our supervisors were able to step in and to keep everyone informed and supported through that process. So that is something that we don't wait to talk about when our responders and SSAs come onto the floor, but it's something that is discussed during the training process. And like I said, I think that is something I'm not able to speak to the training of the other call centers, but I think that is something that makes us very special in doing as much as we can to prepare our frontline staff for what the work will be like once they hit the floor.
And along those lines, I know you all described ways in which supervision and team operation leads and even EAP can assist in one-on-one support. I'm curious if there are times in which potentially a group of employees gather together to talk about the loss or the suicide and what that may look like and why that could be helpful to, again, enhancing this community that you all are talking about.
Yeah, I think that, I don't know of times that necessarily a group is convened, kind of a formal group with regard to a death. I think that it's more, VCL is very well connected in terms of its communication. So there's constant communication over, typically over Skype. So there's constant communication via email, and that is kind of up and down the chain of command. So I think that when, if there is anything that occurs that would be, a particularly disturbing death or event that happens, that multiple people may be impacted by, that there's definitely opportunity for folks to check in with individuals. And, I think as needed, something like that could be put together. I don't necessarily recall anything, like that occurring, other than I think VCL has actually experienced, I think it's 2 deaths, suicide deaths of actual responders. And when that has occurred, then there's been, much more of kind of a systemic kind of community response. and there was time for folks to meet as a group and to process. And um, that's that's more of what I remember with regard to kind of group meeting. The other thing that VCL does, and this is through training as well as through really kind of through all employment, and I think it's so there's an acknowledgement of the work environment and of the stress related to the work environment, and that is attempted, and I wouldn't say necessarily mitigated, but I think there's an attempt made to at least address that, to acknowledge that, and that's through the employee wellness program. So VCL has a very active employee wellness program, and they kind of function kind of hand in hand with the AAP, but also hand in hand with the supervisors. They're able to provide different kind of activities and or opportunities for responders to engage in different things when they're off the phone. So, VCL has like a meditation room. They have there are things that responders can do. They have an exercise room in Canandaigua. I believe there's one in Atlanta too, where they can get off the phone, during a break and use a treadmill, use a Stairmaster, whatever it might be. And this is something that's kind of standard for, well, I would say standard for sort of the higher functioning hotline centers. And it is something that VCL offers. And like I said, it's the folks that are engaged in wellness really, in addition to those types of things, they really do try to build a spirit of community. So, there's always some sort of an event that's happening, or, a potluck or something, and part of it is because, VCL it's a 24/7, 365 operation. So, I think that they do build a sense of team for, the folks that are working the overnight shifts, the folks that are working the evening shifts. And I just think that that's really helpful in kind of mitigating some of the stress and issues that may come with, typically connected with experiencing some type of a death.
And Joi Sabrina, I'm wondering if you have any thoughts on how colleagues may be informally supporting one another. So we've talked a little bit about the formal mechanisms of postvention and the supervision relationship, but wondering if you've just seen how colleagues support one another when one colleague may have just spoken with someone and learned to find out that they died by suicide. How do colleagues support each other in your community?
At the VCL, at all three locations, I think Greg may have termed it earlier, saying, speaking of the support system, but at each location, the responders, SSA supervisors have grown a very strong network of support. So it can happen when there's been a call where there may have been a death, and of course we're in a call center, so there are cubicles, but it's not totally private. And if someone overhears what's going on, we've seen responders who were available, who weren't on the phone, comfort other responders, even if someone has just had a difficult call that may not have ended with a death by suicide, but to be able to have someone nearby who can reassure the responder, or to just give them, a pat on the back and let them know that they did a great job. That's also sometimes done through the IMs that Greg, through the instant messages or IMs that we do rely very heavily on, that we use for communication with the VCL when we've had frequent callers or callers with complex needs who may be taxing our lines, and the responders are able to reach out to one another, even outside of the work environment. So when there are times that there's not a crisis within the VCL, such as a responder or SSA having a death by suicide, but just to to grow as a network in the good times. So we have a lot of responders who get together outside of work to celebrate events or to celebrate anniversaries, like their anniversaries of working with the VCL. Here, Topeka is the newest site of the three sites. We opened in 2018, January 2018. The Topeka site opened, and A lot of the responders here, SSAs here, relocated to come to this location. So they've formed friendships and networks within that. So we've been able to see how that support system, outside of the formal support system, but that informal network has grown and has really lent its way to being a support. There was even a responder. We've had a number of responders who've experienced tragedy in their personal lives, and we've come together as a broad community to support one another, outside of the workplace as well as at the workplace. So it's I think that it would be really difficult to do this work without forming those networks and to also have people who stay in this work. And I think that's something else that's unique to the VCL is our turnover rate. We have people who stay, and it's a very difficult work, but I believe that they stay because the work is supported. What they're doing is being supported, and they know that they're valued here.
Yeah, I think both of you have just shared so many poignant ways in which this network of support is not just occurring after a loss or maybe even after just a challenging call, but it's embedded into the day-to-day philosophy of the work that you're doing. And that is a true statement in terms of kind of turnover and burnout. We know that that's especially high in this line of work for responders and those that are working within a crisis center. So it speaks to, I think, the right recipe that you guys have going on there in terms of informal and formal support and good training and that sense of community.
Yes.
So along those lines, I'm curious how you all work to make sure that you're evaluating your processes of support. So definitely for suicide postvention, but how do you kind of check in to make sure that you all are contributing to ways to enhance the community and the support that you've described, especially thinking about those challenging calls or times or when a suicide occurs? How do you all kind of evaluate your processes and kind of revise and improve over time?
So that is a good question, and it's one that VCL is really just starting to embark on. So so VCL is starting an RCA process, similar to what's done in the medical centers, and also an issue brief process. And VCL has been doing issue briefs for a while now, but the issue briefs that they typically do are related to kind of the functionality of the phone system, or when the phones go down, or when chat and text goes down, or issues like that. But more recently, there have been, and they are starting to follow a protocol for issue briefs if there is, a death that's reported, and there's specific connection to, a medical center or, any type of care or concern that, in similar vein to what a medical center would report. So that's happening now. The RCA process, like I said, that is really new. That's just been within the last 6 months that's starting to happen. So the issue briefs are being, they're reviewed. As they're reviewed kind of with a critical eye to see if there is, any need for an RCA. And if there is, that that process is undertaken. I think that VCL probably, and much of what we've talked about and described has been, and the responders have been probably protected in some ways from some of the experiences that providers in a medical centers setting may face. That typically a suicide death is a fairly rare event, and when it does occur, there usually is going to be a peer review. There usually is going to be an RCA. I think those things can typically, if they're not handled well, they can add sometimes to the distress that providers are already feeling, and that hasn't happened at VCL because these processes are fairly new. And I think also that we're really trying to focus on building into our RCA process the notion that it's we're looking at systems and how systems could perform better and not necessarily, individuals. So we're really trying to be consciously aware of that as, we start kind of down this road. Then in addition, there are other times when deaths occur and we're aware that there has been VCL involvement. And so we'll kind of backtrack and work with the medical centers on, how that veteran was involved with the VCL when that involvement occurred, what the kind of the proximity of the involvement was to the death. But we usually, our RCA process has remained separate from the medical centers, at least to date. The other thing too that I didn't mention, and I think that this is something that's happened over the course of the last 2 years. I think now it's been so VCL does record all calls, and that is something that the veteran callers are notified of when they call in. That their calls are being recorded for quality assurance purposes. The responders, as they're being trained, are made aware that their calls are being recorded, and as part of their training process, they listen to some of their own, recorded calls. The calls are also monitored by silent monitors, so every month a certain percentage of a responder's calls will be listened to by a silent monitor, and they more or less grade the calls. Based on how the responder interacted with the veteran and if they, addressed different key elements of a call with that veteran or third-party caller. So that, I think, also gives the VCL kind of a distinct advantage in terms of things like RCA, but also in things like just quality assurance and improvement as well. So that, if there is some sort of a death, and, whether it was, whether the death occurred during the call or whether the caller called in and there was a death sometime later, VCL has the advantage of being able to sit and listen to those calls, listen to how the responders interacted with the veteran, what the veteran provided as part of the call, look at what the outcome of the call was, and then follow up from there, look at, what the SBC's involvement in the case might have been, and then subsequently look at the care that was provided, by the medical center to the veteran, if in fact the veteran was receiving care in the VA. So I think that has really proven to be incredibly beneficial, and not just with, postvention, but just with regard to overall the quality of the interaction and the quality of the assessment that VCL does with its callers. Being able to listen and really kind of measure exactly what it is that you're doing and hear things that you may have missed or things that you may have wished you had said, or, VCL that has what they call standard work, which is the processes that the responders have to go through or should go through on a call with the veteran. And, they can listen to see if they're, getting through the standard work with that veteran caller and how they manage the call and, where the call goes and how they respond to, what the veteran brings to the call.
Yeah, thanks, Greg. I think those are yet another set of examples of just the comprehensive approach that you all are taking into this work about thinking about both, regular day-to-day engagement in the work and how that does relate to optimizing outcomes and making sure that we're taking care of people, getting them trained, supporting them in a multitude of different ways. What I imagine is that we might have some listeners to the podcast that may be associated with a crisis center, a crisis line that perhaps is looking for growth in the area of support or community or networking, especially related to how to support employees after a suicide does occur, whether that's during a call, kind of afterward, down the road, as you had mentioned, or even working with families and friends that call in to seek support, which is also another challenging facet of the work that crisis lines do. But Joi Sabrina, I'm wondering if you could just speak to kind of the importance of why suicide postvention, that community and that network has really helped your well-being personally and professionally to really help our listeners understand why this is such a critical piece to making sure we're taking care of people in these types of workplaces?
Sure. I think professionally, um, the suicide postvention has helped me mostly in connecting with the VCO and dare I say with buy-in. It has helped to see how seriously and how committed the VCO is to postvention, is to support, has helped me um, to really become a part of the organization. It helps me to feel more genuine in what we're doing. Uh, it would be difficult for me to feel that the VCL is saying one thing but doing another, and to be in a role of leadership. So it has really helped me to know that our executive leadership really believes in being a support to our frontline staff, which has helped me to feel genuine and true and caring about what's happening with our supervisors, our responders, and our SSAs, and being able to offer them support, be feeling comfortable to say if you're not ready to get back onto the phones, then that's okay, and not feeling as though there would be pressure to have someone to just answer the phone, to knowing that what is important to us is that there is someone answering the phone who should be answering the phone. So professionally, that's what the postvention has done for me, to know that one, we care about our responders, but two, we also care about our outcomes. That this is not something, the VCL is not something that we're just putting forward to say that we care about veterans and their families and our civilian callers, but to know that it is something that is really from all the way from our SDS to our director, that we care about our outcomes. We care about the quality of the service that we provide, that our motto is to provide world class 24 hours, 7 day a week service to veterans and their families. That it's not something that we say, but it's something that we do, which means that we care about the product that we put forth, from the training that we offer, that is offered or required of our employees, to how we're following through, and then to know that what we're doing is effective, and if it isn't, to figure that out, and then to do things that fall in line with that mission. Um, Personally, it has helped me to be able to come back to work. When I was working as a supervisor on the front lines, there are days that it's just hard to get up and to get out, but it made it easier to come to a place where I felt as though the mission was true, and to know that if it would be a bad day at work, if there were to be a completion, that even as a supervisor, that I knew that I could turn to my team operations coordinator for support and for guidance, and as a team operations coordinator, to be able to go to the chief of staff, and to feel like I could speak with him, I feel like I can speak with Dr. Miller, our director, and to know that I would be supported. So it's helped me personally to be able to come back here when there's been a hard shift, when there's been something that's just been difficult to deal with, and it's helped professionally to know that I would be supported and supporting those who work at my site.
Yeah, and Greg, I'm curious if you have other thoughts to share, again, with folks that may be leadership at crisis centers or crisis lines, or just other folks that are involved in other workplaces, on tips or strategies of how to build this type of culture that you all have described throughout this podcast episode. Where would you help people kind of head down that road if they're trying to, approximate and have similarities for the culture and community that you all have built?
Well, I think it really starts with acknowledging that that it's a need, and that staff do need to be supported, and that staff that staff do care about the folks that they're working with, and their veterans, and so that if there is any sort of death that occurs, and suicide death obviously is probably one of the most difficult, because it's typically not anticipated, and usually folks are actively working to prevent it and to treat whatever the underlying conditions are that might lead to a suicide death. but any type of death in I think a facility, can be difficult. So I think just being aware of that, being open to providing support, specific to suicide deaths, I think that, if facilities would be, or, facilities or whatever locations throughout VA or in the community, just be open to being able to provide support. I think planning can go a long way. So, looking at what strategies you could put into play if the death occurs, having leadership, acknowledge that that something has happened and that it may have an impact on folks, and that this is what they have put in place, to provide support for their employees, that they want to make sure that their employees can remain healthy and take care of themselves, as well as provide good services to the customers that they serve, whether they're veterans or not. I think that's all very important. Within the VA, I think one of the things, we've certainly encouraged medical centers to look at and try to put together some sort of a postvention plan, whether that be specific staff at a site that may be able to respond in the event of a suicide death, to work with all staff that may be impacted, and not just clinical providers, but if there's a veteran who was coming in frequently and rode the DAV van, it might be DAV staff that are impacted, or EMS staff or canteen staff or whoever. You never know who may be impacted by a suicide death. So I think that that's important. I think that we have some great resources that are available. I would encourage folks to use the Vision 19 MyRic, both the suicide consultation line, but also the suicide consultation line, now that it provides postvention, resources as well. So I would encourage, and I have encouraged many staff to call there to seek assistance. And then also for supervisors to be aware of what resources are available for their staff. So, what are the EAP resources available? How do you access those resources? And, how can you refer and assist any of your staff members that may be in need to connect with those services?
Well, thanks so much. I'm going to do my best now to summarize a lot of the key aspects that we hit on, but then I'll turn it back over to each of you to see if you have any last words or anything that you want to add on to the summary as we finish up the podcast for today. But I think some of the really big takeaways that I heard both of you speak to so eloquently was, first and foremost, the need to really have a robust training for employees that are working in crisis lines and crisis centers, and that's a real key cornerstone to building that well-being that I think you all are striving for. That good training up front is essential to being able to foster a sense of community and a supportive place, and thinking about that in a really comprehensive way of how are we enhancing well-being for those folks that are working within a crisis center or crisis line, so that it's not just after an unfortunate outcome, but how are we supporting each other each and every day in the challenging work that you're doing. And then I think we talked a little bit about the importance of having a plan that's established, but of course you go back to revise and improve throughout time, but making sure that that plan is in place before an outcome occurs, so that you're able to, as a supervisor, for example, easily access resources and provide the support that's needed and kind of be there for the person in the moment versus worrying about what to do or how to do it. And I think a big part of what I heard both of you talk about too is the need to have just really clear communication. So starting again back to that training up front of what this looks like, but communicating and fostering and actually promoting employees to talk to one another about the things that they're struggling with or the things that they're finding that help them be a bit more resilient. And then I also just wanted to close on what I think, is spoken to really beautifully, of this idea of world-class service that I think the VCL does provide, but the fact that you all are also thinking about world-class service back to the employees, the hundreds and hundreds of responders and staff and SSAs that are part of the 3 locations, that part of offering world-class service is making sure that you all are taking care of one another too, and that's the only way that we can have a chance at providing world-class service. So I'll pause there and see maybe first, Joi Sabrina, do you have anything else you'd like to add in, or any final thoughts or anything that you wanted to get out earlier but didn't get a chance to say yet?
I believe you summarized it beautifully. I think the biggest thing that maybe we want to get across is our passion, the passion that we have for serving veterans, their family members, their friends, their battle buddies, and of course serving our civilian callers who may contact us in a time of crisis. That we really do have a passion for being available, for being prepared for their call, and for really just being able to give any assistance that we can to someone who just may be in a time of crisis, especially for those who are accustomed to being, air quotes, strong, and in a time where they need someone to lean on. We have a huge passion for that, and just really want to make sure that the listeners know that.
Yeah, thank you. And thank you for your passion, too, that we got to see a glimpse of during the podcast today.
Thank you.
And Greg, anything that you want to add in?
I would just say that I think that, whether it's a call center in the community or medical center, that I think that they would really, in some ways, benefit themselves and their staff if they did try to model more on what VCL does with regard to postvention, but also, postvention as in the terms of just general support and, kind of being there. Obviously the fact that VCL deals with suicide on a daily basis, multiple times, it makes it, imperative that they have good postvention services and resources and support services available. But it really should be the same no matter the location, whether it's the community or a medical center. And I know that, if I would just put in one plug, I would say for, medical centers to really try to do the same thing for your own staff, and particularly your suicide prevention coordinators. I think oftentimes my experience has been that their day-to-day experience is not all that different from a VCL responder. And oftentimes they're kind of out there on their own, within the medical center, and, they're seen as the go-to person whenever there's an issue related to suicide, but they need that support and they need that sense of community, in connection to the medical center and to a team, because we have a lot of good people out there that are SPCs, and we want to keep those people, and the best way to do that is to provide them good support.
Well, fantastic. Thank you both again for joining us today for our episode, and thank you so much for, I think, really illuminating how support and community isn't a one-time task, how it's something that we have to engage in every day in order to really have the sense of community that means something, and to be able to offer the care that we do in your cases to veterans, but also thinking broadly in this profession and this field, how important it is to make sure that we're supporting each other. So thank you both again for joining us for the episode, and thanks to our listeners for listening in, and we encourage you to check out some of our other Suicide Postvention podcast episodes as well. Thank you.
Thank you so much for having us.
Thank you very much.
This podcast is brought to you by Uniting for Suicide Postvention, USPV, in collaboration with the American Association of Suicidology Clinical Survivor Task Force. USPV offers suicide postvention resources designed for family, friends, acquaintances, employees, supervisors, managers, and professional caregivers, including mental and medical health providers. USPV is funded by the Veterans Health Administration Office of Mental Health and Suicide Prevention. Thank you for listening, and be sure to check out our other episodes in this Suicide Postvention series.